Yeah, so beginning in the winter, the late winter of 2023, early 2024, I had pretty poor sleep and just poor nutrition overall. And when I would play over time, I noticed that I'd have pain in the side of my hip or the TFL area,
Hmm.
which would extend to the groin as I would play. And it got to a point where at first it was just maybe some soreness after games. And then it got to a point where it'd be a sharp pain. And whenever I'd play, it would go up to a 9 or a 10 in terms of intensity. And I would be limping on the pitch. So it was really bad, and it continued for about 8 to 9 months, and it was chronic.
Right. And what have you tried before coming into the Hyperarch Fascia Training?
So I tried PT, and that did not work. And actually, I found one of your copycats, which claimed that they could help me with the injury,
Mm.
and I had very little results from them. I mean, they use a lot of your exercises, which I will not disclose, but they use some of it or different variations, but it was very mindless, and they did not know what they were doing, and it was quite obvious that they were just trying to just take from your work without giving credit nor without giving proper training and
Mm.
coaching.
Got it. So when we started doing the work, we had assessment, right? And we identified the imbalance that you had, and also we learned more about your body and what type of imbalances and weakness that you had at the time. And what would you say at what week did you start to notice like changes in your body, and then the groin and the hip pain start to dissipate?
So immediately after day one, I felt some relief. I felt some relief. The pain went, it didn't go away, not at all, but it was much more reduced, and I just felt more comfortable, at least doing day-to-day activities.
Mm.
And I'd say I noticed a big improvement in the fourth week, between the fourth and the fifth week,
Mm.
where I began feeling some glutes on some exercises. And between week 5 to 8, I really start to notice changes. I noticed my pain went from being an active pain to passive tightness, and by the end of the 12 weeks, it went to just non-existent. I noticed that I began to feel glutes during towel curls and during other exercises. I just felt more connected overall.
Right. So what, like before, you started to do this work, what made sense to you in terms of our messaging? Like, is there anything that you find it that that resonated with you that made you wanted to participate?
Yeah, I think I really resonate with the fact that there's some individuals, right? And I couldn't really find the explanation to it, but they just looked more fluid. They looked light on their toes, on the balls of their foot. They were just effortless on the pitch, and I felt very robotic, and I just didn't feel good. I felt slow, robotic, kept getting injuries, other pains, and I really knew that there was something that was missing, but I
Mm.
couldn't identify what it was until I came onto your page and until I really got my hands-on experience with the program.
Got it. So when, of course, the training is very different than the mainstream type of work. We did not lift any weights. We only use the marble and medicine ball. We use a lot of the fascial co-contraction, meaning using the movement to help the body recruit the glutes, right? In terms of the difficulty, like your own sensation when you do this versus, the mainstream type, you also lifted weights before, right?
Yes, yes.
So, like, what would you say the difference is?
Yeah, so it's much more difficult, I'd say. It's much more difficult, but it's much more rewarding as well. When I would go to the gym, you do the bench press or the squat or leg extensions, whatever exercise may be. And obviously you feel like a pump, right? And you feel some soreness after delayed DOMS, delayed onset muscle soreness. I believe that's what it's called.
Hmm.
And but with HFT, I noticed that it was very holistic, right? So I feel the entire body connected on a lot of the exercises, and definitely a big focus on sensations in HFT because it really addresses the root cause of the issue, not just what it could be on the outside, right? Because you could have maybe like an Achilles issue, or in my case, a hip issue, but it could be a holistic issue, right? That's just the weakest part, or the
Right.
part that's being suffered from.
Right. Perfect. Okay, so what would you, the final question I have is, what would you describe, like how would you describe HFT to someone who have never tried it before? Now you have tried it. Like how do you describe it in your own words? There's no right or wrong answer.
Yeah, I mean, obviously you can't really explain this to the best degree, but I'd say that it is a very holistic type of training, and it really focuses on um, the sensory aspects of the body, right? So it really focuses on what you feel, where you feel, and when I do it, it feels intense. It feels you need to be really concentrated during it, but overall it feels really rewarding, especially once the results come through. The speed, the power, and the athleticism.
Yeah, so what do you like after you play soccer or football now, what do your body feel afterwards versus before? How you
Yeah,
used to
so
feel?
before I remember I'd be doing it and I'd get maybe some pain in the Achilles, some pain in the ankle. I would feel just awful, like it just feels sore
Mm.
days after. But now when I play, I feel much lighter on my toes. I feel that it's much more effortless. And if I do get sore, I get sore in the right places. So I get sore in the glutes and the abs. And I feel much more effortless on the pitch.